Okay, well, welcome. Thank you so much, everyone, for joining. I want to take a moment and just thank you for your interest in this session. I know that recruitment here at Penn State hasn't come without its challenges. So I want to go ahead and start by saying thank you for showing an interest in learning about what's up and coming that we're excited to share with you today regarding how you can think about recruitment from an innovative standpoint, and also how to consider reducing health disparities in your research by being more inclusive in your recruitment approaches. So this is our cheer team. Many of you are return attendees from prior cheer sessions that we've had. So thank you so much for coming back. And for anyone who's new, I'm Jennifer Poger, here joined by my wonderful colleagues, Paula Moody, Andrea Murray, and Jess Abrams-Schrodel. And we are part of the Community Health Equity and Engagement in Research team here at Penn State College of Medicine. We sit within the CTSI here at Penn State, and we also are in partnership with the Social Sciences Research Institute. And so our initiative is really to try to bring that equitable lens to research and also help to enhance community academic partnerships. We know that there's a lot of supports that are needed and resources to help build meaningful collaborations across various disciplines and also external partnerships as well. And so we're really trying to provide the support that our teams need, the education, and whatever we can do to make those partnerships sustainable. And so one area that we're really focused on is helping with recruitment and trying to think through outside of that box how we can engage participants in research and really rebuild the trust that's been eroded over time for some of our marginalized communities. And so we're joined by our wonderful guest presenter here today, Emily Kissinger, who's our marketing manager for research. So probably many of you who are here today are familiar with who she is. You maybe have worked with her in the past, and she's been really a true gem for us in our CTSI efforts to try to work on some new recruitment materials for the College of Medicine and also all of our across Penn State University. So she's part of the Office of Marketing and Communications here at Penn State College of Medicine, and she'll be speaking on a new recruitment toolkit that is underway that our teams have been working together to develop to be able to offer more streamlined resources for all of our research teams here. So just some brief logistics. This presentation is being recorded, so we do ask that you please raise your hand to ask questions. And feel free to ask questions. We'll have a Q&A session time devoted at the end, but along the way, we'll be tracking your questions and trying to respond in the chat while we're presenting as well. Closed captioning is enabled, so feel free to use that feature if you need to. And again, use that chat feature to make comments, share resources, make connections. All presentation materials will be shared at the following of the session. I'm just going to hide this meeting panel so you guys don't get disturbed by that. Sorry about that. So for our session goals today, it's really to talk about Penn State resources to support research recruitment. So some things that might be new to you are our utilization of the Lion Mobile Clinic for research. And so this is sort of an exciting new initiative that I'll be talking about next, that I encourage you to consider as you think about the needs of your project and if it might best serve you. We'll also speak about the role of community health workers and how they can assist in recruitment for some of our diverse, racial and ethnically diverse marginalized communities. So thinking through how to build those relationships within the community and using community health workers as really the connector to your study participants. We'll then speak a little bit about a volunteer repository that's new on StudyFinder that is underway, going through final approval stages, that will be offered as an added resource for study teams. And then we'll get a brief view of CTSI's new recruitment toolkit. And we're excited to share that as well. So mobile health clinics across the US, we'll start with this mobile health clinic piece. You can see that there is really widespread utilization of mobile health clinics, and this has really ramped up in the past decade, I would say, most recently during COVID by bringing bringing healthcare really to these remote communities or to places outside of the typical health system. And so really decentralizing where healthcare can take place. And why do we do this? We know there's a lot of benefit on really getting out into the communities to bring care, bring screening services, and also bring research, right? So that's what we'll talk about next. But broadly speaking, mobile health clinic has impacted healthcare access by really breaking down barriers to transportation, particularly in our rural communities. We know transportation is a huge barrier. Also insurance status, financial costs, lots of cultural barriers, perceived absence of patient-centered care. There are psychological barriers, intimidation by healthcare settings. So it really can reduce some of those challenges that participants and patients might feel coming to a clinic setting. So it's been very helpful in terms of providing increased care. It also turns out that it improves health outcomes. So by increasing the adoption of preventive measures and screenings and intervening for chronic disease management. So oftentimes when folks are being seen on a mobile health clinic, diseases can be identified. So for example, if there's a blood pressure screening that's taking place, we can intervene for chronic disease management of that hypertension. It also can lead to reduced healthcare costs. So a reduction in emergency room utilization and length of stay for hospitalizations. Because we're seeing patients earlier, we're getting more of that preventative care in, we're identifying things earlier on in the process. And then there's an opportunity to establish trust and rapport. And this is really where our cheer team comes in by having that continuous presence within communities. And so, we really want to break down any barriers to patients not only receiving optimal healthcare, but also being able to learn about research opportunities. And so really trying to get out into the community to learn about what the community needs are, what the communities are dealing with on a day-to-day basis, and really trying to be responsive to that feedback that we receive, building that trust so that they're more likely to be interested in learning about research opportunities and also being proactive in their health. And so we've partnered with Evangelical Community Hospital, and here's one of our wonderful colleagues, Mike McShane, who's really spearheaded this effort through this community hospital in terms of bringing this mobile health clinic across areas in the catchment regions of State College. So we'll talk more specifically in the next slide about where he's traveled to bring care to rural residents across Pennsylvania. But this is a look inside this 38-foot basically clinic on wheels. So there's patient rooms to perform quite a few clinic procedures, and there's a waiting area. There's lots of facilities for taking samples, storing samples, taking lots of biometrics. And so he's really had wonderful success in being able to travel with this mobile health unit across several counties in rural Pennsylvania. And so he initiated this really just towards the tail end of the many peaks we've had of COVID. So in May 2022. And he does about 4 to 5 events per month. And most of those locations, as I mentioned, are in rural areas just outside of the State College catchment area. So including Snowshoe, Pennsylvania, Phillipsburg, Center Hall, Howard, Bellefonte, and of course, State College local areas. And services offered include these blood pressure screenings, social determinants of health, which is a huge driver of understanding where gaps in care are for a lot of these patients. He also offers, and his team, preventative health screens, flu vaccines, COVID booster vaccines, and health literacy education. And so many of these early events were a lot of this sort of preventive health screenings, but most recently he's received additional funding and guidance to be able to provide more care on the unit. And so instead of just being able to screen for certain conditions, we're now able to diagnose and treat. So that really opens up the opportunity to have more community members seek out coming to the unit for care. And then the beautiful effect of also being able to learn about research opportunities. And so that's really where our team is coming in to partner with Dr. McShane and the wonderful medical students that help lead that mobile health unit effort. And so we're really hoping to increase access to research opportunities within these rural communities and also decentralize where research takes place by conducting low-risk research on the mobile health unit. And so what we've done so far, and I'll pass it soon to my colleague Paula, who's been able to attend these wonderful events and learn from the community. But basically what we're trying to do is get to know these folks, get to learn a little bit about them and start to build that trust, and then be able to share some research opportunities. So oftentimes we go into a community and we talk about what we need, right? The research that we need them to sign up for to help us answer a research question that we have posed. But sometimes it's nice to really flip the script and learn about what the community needs and how we might be able to address those needs in a very meaningful and relevant way for them. So the first phase of this is really just being able to understand what opportunities might be applicable to the different folks that seem to filter through these mobile health clinic events. And that's really the starting point, is being able to bring with us research flyers that are relevant to the different populations. And we're starting to learn more about these different staple events that take place, and as more are being planned, the types of folks that attend, so that we can bring very relevant study flyers. Now, when we think of research actually taking place on the unit, we're not there yet, but there's certainly opportunities to expand and go down that wonderful pathway, so that we can decentralize, not having these folks that live in these rural communities come all the way to Hershey Medical Center, for several visits to have care conducted. So the types of research that would really fit in this paradigm would be our low-risk studies that preferably are remote. We know that during COVID, a lot of studies were able to really pivot to a remote setting, especially if it's a survey type study where you're just asking participants to complete different measures at whatever frequency you have set up in your data collection protocol. And so it would be those types of studies that would be very relevant for us to recruit from. So if you're looking for rural populations, we know that there are challenges and barriers related to transportation. Those are the studies that we want to be bringing with us, the ones that are low risk, that really don't require many in-person visits, that would be outside of the catchment area in which we are traveling to. And then when we move to phase 2, being able to actually conduct some of these low risk studies. So if your study maybe just has one blood draw, or it's a blood pressure study, or some different biometrics that we can collect on the unit, those are certainly things that we are working towards being able to have an electronic version of informed consent through REDCap. So our team is sort of working that out with IRB and trying to see what's possible in terms of compliance and sticking with the regulations, but also making sure that we can enroll participants ethically on the unit, and then they can come right in and have the study visit completed right there. So we're moving towards that. We're not there yet, but right now we're at a point where we're able to ask all of you on the call if you're interested to, and on the next few slides, we'll talk about what those steps look like, to reach out to us to share your study flyers, and we would bring them with us to the events that we attend. I'm going to now pass it on to Paula, who can sort of give you some background on what we've done to date with some of the studies that we've advertised for, and what it's been like to attend the mobile health unit events.
Hi, good morning, everyone. I'm Paula Moody. As Jen said, I'm part of the CHEER team. I am a research project manager with the CHEER team, and I have had the benefit of going to the mobile health unit in person. So what you're seeing on your slide here are examples of flyers that I have taken with me to the mobile health units that that Dr. McShane and his team are coordinating. I feel it's important for me to recognize the PIs behind these studies here. So the Healthy Brain Child Development Study that you see on the far left of your screen, that's Dr. Jennifer Cruz. She's conducting a longitudinal study about healthy brain child development. The second one is a Mindful Moms study, and that is Dr. Amy Moore. She's conducting a study about women who are breastfeeding and how stress impacts breastfeeding with folks. That particular study is completely remote. So as Jen said, for the folks in the area that the mobile health unit, I'll say, touches, this is really ideal because they can do this from their home. The third one is regarding eating behaviors in children's children 8 to 9 years old. And that's Dr. Elena Pierce. Dr. Pierce, you're on this call, are you not? Hi, how are you today? So Dr. Pierce's study, we have taken her flyers to our mobile health unit as well, which is lovely because it's a combination of things that they can do in person, but there's also some conversation that needs to take place outside of those in-person sessions. And then the last one is related to individuals who have diabetes and how stress impacts their diabetes management. That's Dr. Naja Raja Khan's study. That's on the far right of your screen. A couple of things that I'll share with you about the mobile health unit is that Dr. Mike McShane and his team are very deliberate about, I'll just say, mixing up the places that they take the unit to. What I mean by that is he tries to take the unit to locations where there is already some activity, meaning he's not parking in the middle of a grocery store parking lot and hoping that someone comes to the mobile health unit to get a flu shot. Instead, what he's doing is he builds those visits around other activities where he knows that there is a flow of people with a trusted community member. An example of that is I attended a mobile health unit event at a local church in Center Hall. I attended a mobile health unit event at a local library where they were already conducting a mom's story time. They were doing some health literacy activities related to eating with young ones. Dr. Pierce, sorry, this was before we had met you, but that would have been perfect. And he's actually planning to go back to other local libraries where little ones are involved, and he can do some health literacy education for the parents who bring their children to these events. A third example is there was a soup sale. It sounds maybe kind of unusual, but a soup sale at a local church where Dr. McShane had partnered with one of the coordinators of the soup sale. And this individual said, we have a steady flow of folks who are coming, and we would love for you to come and offer them information about, just overall preventative health behaviors, or not preventative health, but healthy behaviors and some preventative things like a flu shot or a COVID shot. So again, what he's really trying to do is build trusting relationships with kind of pillars of these communities, bringing the mobile health unit to these communities and delivering preventative health care and now acute health care. We're so excited that he's approved to have this piece of the mobile health unit kind of going to take place for these individuals. So he's just, I guess the point I'm trying to make is he's very deliberate in trying to reach a very broad population of folks who live in these rural communities. So if as a researcher, you feel like those are folks that you want your research study to touch, if you will, then designing your flyer and getting, of course, IRB approval for community distribution is critical, but also designing your flyer in a way that makes it very clear to potential research participants what they need to do. Some of that involves whether or not they need to travel. That's really critical in these areas that Dr. McShane is going to, because as Jen said, transportation can be a tremendous barrier for these folks. So it's not necessarily that they're not interested in participating in research, but they may not physically be able to do that if it requires them to go to a location that's far from where they live. So if that fits your research study model, then please get in touch with us, and I'm happy to take those flyers with me to Dr. McShane and his team. Dr. Stevens, I see you on the call. How are you today? Dr. Stevens is part of our University Park College of Medicine program as well. And he's really intimately aware of what Dr. McShane is doing and bringing the College of Medicine students who are located at University Park along for the proverbial ride, if you will. And they are critical in building relationships with community members up there as well. So if you have questions about this particular process specifically, please reach out to us. And we're happy to share your information with the folks under Dr. McShane's incredible effort to reach these communities. Thanks.
Great. Thank you so much, Paula. Yeah, and a huge shout out to Dr. McShane. He wasn't able to be here today, but he's just been a phenomenal advocate for really trying to reduce health disparities in rural populations. So we're excited to be able to continue to partner with him through this effort. And so, as Paula had mentioned, there are some guidelines that we, of course, put in place to allow for the distribution of your study flyers in the mobile health unit areas that we attend. And so the first and foremost is that you would need to have IRB approval to distribute in those community locations. If you don't, you'll need to complete a modification to your project to have your already IRB approved research flyer distributed in that way. And then it would be helpful for you to reach out to the cheer team to share a little bit about project specifics. So while our study team cannot handle any informed consent at this time, and again, that's sort of phase 2 of what this might look like. Right now, we can share your flyer, but some questions might come up, and it's a very fine line of what we can share and not share. We really can only share what's provided on the flyer, but if there's any helpful background that would just be good for us to try to determine which event would be most useful for us to attend based on your study requirements, those are good conversations for us to have before we go. And then we ask that you send us at least 100 approved flyers. We will take them to multiple events, not just one. So if we can have a stack handy, we will make sure that we get them distributed. And we've had great success overall in terms of sharing flyers, even if we haven't necessarily been at a population that is eligible. For example, if it's a geriatric population and we're talking about a healthy mom and baby study, it might not be necessarily those participants that would be enrolling, but they certainly could let their family and friends and neighbors know, and we've had a lot of that take place. We are still working to capture those metrics. So one thing that our team will be doing is working with each of these study teams that we help in this way through the mobile health clinic to learn if this was an effective methodology to recruit your study population. And so we encourage all study teams to be tracking this. And this is a theme that you'll see as we talk a little bit later about the different resources that we've developed in our overall recruitment toolkit, which will be launched soon, is really tracking how your participants or potential participants are learning about your study. So even if they're not eligible, how did they find out about your research? That's really, really useful information for you to know as a research team, also for our marketing and communications teams to learn from, to understand return on investment so that they can help inform future teams based on, different trends that are showing up. So we will be asking for that information. So please do make sure you are tracking that. And we do have a template that we're working on to provide to you through our recruitment toolkit to help make that a little bit of an easier process. Also thinking through if there's any type of community givebacks that we can bring with us along with your research flyers so that, again, it's not this top-down approach where we're tapping in the community, asking them to fulfill a need that we have. Maybe it's also providing another opportunity that would be very beneficial to them. So if it's information about support groups, information about other ways that they can be involved in learning about a particular condition, a lot of times these are caregivers. So if there's any resources that we can bring along to provide to them that will help them in that role, that's something that they would appreciate as well. This is the contact information both for Mike McShane's team as well as ours, and you'll see our contact information later on in the slide deck as well. So please do feel free to reach out to us directly, and we can certainly work with you on the upcoming events that we will have and coordinate how we can help you advertise. It's free, so it's kind of a win-win for your research teams just to see if those are certain populations that you're looking to recruit from. It's a pretty low lift on your end in terms of the work that's involved. So our team is happy to do the rest and see if we can, move the needle on rural recruitment for research. We're now going to talk about community health workers. And so, one of CHEER's pillars is really reducing health disparities and improving health equity across the work that we do. And so, we've talked a little bit about rural recruitment, and that, helps address some health inequities, but we also know racial and ethnic inequities exist in research and in health outcomes. And so we have some experience utilizing community health workers, and I'm going to pass it on to Andrea, who has really spearheaded this process here at Penn State. And she can talk about the role that community health workers can play in the research process. And then we'll share a little bit about next steps of what we're hoping to pilot here through the CHEER program to offer to research teams through utilization of this workforce.
Thanks so much, Jen. Hi, everybody. As Jen said, Andrea Murray, a part of the CHEER team here at the Penn State College of Medicine. And I love talking about community health workers and, how they can play a role in research. We are so excited to be able to include community health workers in some of the projects that we have here at the Penn State College of Medicine. And you can see here that these CHWs have different names in different organizations. And that's how we've really worked with our community health workers in the communities that we serve, is by partnering with different organizations throughout the Penn State Health catchment area, as well as the Penn State College of Medicine and Penn State University catchment areas, is by reaching out to our organizations, our community-based organizations, and connecting with their community health workers that are doing some fantastic work in the communities that they serve. So here, the APHA definition: a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. And I think that's really important as we think about how community health workers can be so integral in research. They're trusted. These folks are working with our community day in and day out, when they're walking on the streets of their communities, when they're out to dinner, when they're in the grocery store. These folks are recognizable and approachable. And so that's really kind of the notion behind them working with us in the research spectrum. So we can go to the next slide here. And so what are some of the facilitators of community health worker partnerships and research? We know that the community health workers can actually be a part of a research team before the research even starts. And how they can be super helpful is actually thinking about their communities and what are the right questions to be asking out in their community. Although we know the topics of our research really well through our education and other in research that goes into that, but it's really important to know the community that we're going to work in very intimately. And so having them on our team as a part of the beginning stages of research is really important. They really help advocate for community needs. And in doing that, they really know what the needs of the community are. And they work as those community health champions. They really are champions for their community and trying to connect these folks with the resources that they need, and as well as really finding and figuring out how to have the community best served by other organizations as well. Helping recruit participants and addressing barriers. This is, I think, the number one thing that when I think about these community health workers, I had the opportunity to sit down and talk with a few and said, these questions that we all have, why can't we get people to come in for research? Why can't we get these people interested in the research that we're doing? And they looked at me and said, Andrea, you have to understand all these barriers that people have day in and day out. You can see this if you've ever done a poverty simulation. If you haven't, please do so. But it's really interesting to see that, the everyday people that we would love to be a part of the research that we have and that can create diverse research really have a lot of barriers, and thinking about recruitment. And having community health worker again on your team as at the beginning of the research process makes you think about these barriers and how they can be overcome with the research that you're doing. Equipping these participants to make informed decisions. We know that there are simple barriers like health literacy that may be apparent with our community members in really understanding the research and what their role is in the research. And so community health workers have the ability to be able to talk about the research in a way that's understandable with our community members. Again, improving health outcomes for those underserved populations. And then also communicating with the public about research findings. So interestingly enough, we can get them to help us get these folks interested in research and be a part of the research. But then what happens afterwards? And we see a lot of disconnect with our communities in this space. As you know, we come and we ask them, please be a part of our research. We need you to be a part of this research for us to make this happen. And then they are, and then they sit there at the end and they have questions like, well, what happened, right? What was the outcome of that research? So we can go to the next slide. And so what we plan to do in the future here with the cheer team is to pilot a community health worker workforce to be able to do this work in the research that we're doing here at Penn State. So we've had this experience. We've utilized community health workers for study recruitment through the racial and ethnic approaches to community health. You can see the pictures here, our own community health worker through Penn State REACH project, Madeline Bermudez. She's sitting there at Lebanon Family Health Services, recruiting folks to be able to take a survey about their farmers market nutrition program. It was awesome. We were able to collect 100 folks in one day for a survey, and we were able to do that survey in both English and in Spanish because Madeline was bilingual, and we knew that the population there that was being served at the WIC office, really we needed to capture the Hispanic and Latino voices, as that's one of the largest populations there. So what we hope to do is hire community health workers from partner organizations like federally qualified health centers to support research. They can help in that advertisement development. They can help in recruitment and enrollment, data collection and lay dissemination. And so having these folks on our side and really understanding and gaining the knowledge that they need to be a part of the research is really something that we're interested in doing, and we know will help uplift the research that we're doing here at Penn State.
So thank you so much, Andrea, for that. And we'll be able to soon have a breakout to kind of talk about some of these that we've already mentioned, these different methodologies to reach both rural populations and some of our diverse counterparts in urban areas as well. So I just wanted to share before we go to that breakout, a third resource that is up and coming that's part of StudyFinder. So some of you are very familiar already with utilizing StudyFinder to post your research advertisements to and let the broader community learn about your research. But our team is partnering with IRB and our marketing communications team here at Penn State College of Medicine to work on having a volunteer repository. So a little bit more of a deeper dive into understanding the different potential participants that may be eligible specifically for a research study. So they have the opportunity to register, and this can be done. I mean, we could be taking, we have iPads that we take up with us to the mobile health clinic. So as we're sharing about existing research studies with the flyers that we bring with us, if participants are eligible for those or not eligible, they could still theoretically sign up for this volunteer repository, right? And so then they could find out about other studies that they might be eligible for. So it kind of breaks down those barriers in communication to learning about these research opportunities. So this is sort of the beta site. It's not live yet, but it will be launching this spring, and there will be communication that will go out. Once it is live, we'll make sure you all receive that to see if this is something that you would like to include. Of course, all of these methods have to be IRB approved, but this is quite an easy, you just select certain fields in the IRB application or a modification if you would need to do so to include the volunteer repository as one of your recruitment methods. And so we would basically be asking potential participants or those interested in being part of this volunteer repository to register. And I'll go ahead and show you what their profile questions look like. So we do get at some demographic information. I realize this is a little bit hard to see and it's a little bit small, so I do apologize, but I'll go through the different fields. So basic demographic information, their date of birth, and first and last name, and then race, ethnicity we garner as well. And we do ask for gender identity and gender at birth based on, how to appropriately ask and make sure we're using inclusive language there. Also, we capture how they would best like to be communicated. And then we really get into the crux of the types of research that they're interested in learning about. So areas of interest. And then they have a box that they can let us know if there's anything that they would like to share with the study team. And so the idea is that this could be a way that if you're a potential participant, you could really be putting in different eligibility about yourself. And so then you'll see studies that fit that profile, that you can basically have as a study of interest. And then that would sort of populate down here. And what that will allow us to do on the CTSI end is to kind of be the honest broker for any participants that have or that are part of this volunteer repository that might be interested in your research, and then we could contact them on your behalf. Now, this is all still kind of being worked out to make sure we're doing this in the most appropriate and ethically responsible fashion. So again, once this is finalized, we'll be sure to share with study teams and what that process looks like. But the end goal is really just to be able to capture a broader repository of folks that might be interested in the work that you're doing, so that you can more easily have sort of a group that you can already reach out to, or have CTSI reach out to let them know about your research. So just another opportunity for us to kind of get the word out about all of the opportunities taking place. And so now we're going to go into a breakout, and what we're going to do here is in small groups. I'll put you in groups about 5 to 6 in a group. And I want you to kind of just think about, because I'm sure some of these opportunities were new that you maybe didn't know existed here throughout Penn State. And so thinking through how maybe you have an interest or a need to recruit in some of these rural populations. So how might that Lion Mobile Clinic benefit the work that you're doing? Also, is the utilization of community health workers something that you're really interested in to enhance diversity and inclusion in your research? And that's something that we certainly would want to have an individual conversation with you and your team about, to see how we can really start to pilot that effort, because that's something that we've been wanting to really put into practice. We just need some teams to pilot it on. And then also the StudyFinder volunteer repository, just garnering thoughts and on feedback on if you think that would be something that you would like to utilize as well. And Paula's going to put in the chat, if she hasn't already, a Google document that will have these questions so you can kind of see the different topic areas to discuss in your group. And then we also ask that if you are interested in having CHEER facilitate any of these services for you, or you just want to learn more, please fill out, you'll see a table that's on the Google document. If you can just go ahead and fill out those columns, and then we'll know that you're really interested in learning more about some or any or all of these, and we can make sure that our CHEER team reaches out to you for further follow-up. So I'm going to go ahead and place you in breakouts. And we'll give about 10 minutes or so for a group discussion, and then we'll bring everyone back. Okay, I think just about everyone has filtered back into our main room. Hopefully you were able to engage in an insightful discussion about some of these different recruitment methods that we've shared today. And just looking at the Google document, it looks like we have quite a few studies that are interested in the mobile health clinic, the StudyFinder volunteer repository, and a few of you for the community health worker piece too. So we will certainly be directly reaching out to share, and certainly once some of these initiatives go live, there will be lots of communication about the best ways to access and some of the different specific requirements that you would need to know. So stay tuned for that, but really excited to see some energy around some of these different methods, and certainly hoping and really maintaining that glass half full perspective that I think these will really be very fruitful efforts to address some of the disparities that we're seeing, and some of the barriers that we know that these participants are facing when it comes to signing up for research. So stay tuned for that. I do want to now close with sharing a little bit about our CTSI new recruitment toolkit that, again, is yet another resource that will be coming out this spring. And I'm going to turn it over to Emily, and she'll share some of the specifics. She's been really an integral part of its development. So thank you, Emily, for presenting this piece today.
Great, thank you. I'm so excited to be here, and thanks to everybody for your time. This has been a kind of a long time coming, but I'm so excited to be working with Jen and Andrea and other folks in CTSI to get this kind of across the finish line. I think This will be a very useful toolkit for research teams, as well as a little bit selfishly for myself, because I see lots of familiar names on the panel here, individuals that I've worked with in creating flyers and some other things. So I think this will be really useful. So a couple of the goals and the content areas for the toolkit, providing some recruitment best practices. So a lot of this, the content speaks back to some of the things that Jen has talked about already this morning. We'll have some Penn State specific templates. So Penn State tools and resources in looking at your study feasibility, downloadable templates. So think about those study flyers that I've interacted with probably many of you on. We'll have self-service. Am I still muted? Can you hear me? Okay. Self-service tools that you'll be able to download a Word document and kind of fill in your content and create a flyer on your own. But it will have a standardized look across all of so that we're using standard colors and logos and such. And then Jen's mentioned a couple of times the importance of tracking how participants or how those who have inquired about your study have heard about it. That's so important for us to keep an eye on so that we can continue to develop new tools. So if we go to the next slide, just gives kind of a sneak peek of what the recruitment toolkit will look like. So there on the far left, those two screenshots are the site. We're working through the approval process on these. So you can see kind of the categories of content, best practices on engaging the community, on putting together the recruitment materials and recruitment enroll populations, and then getting started at Penn State, the study feasibility tools, no cost recruitment strategies, and then some paid recruitment tools. And then the other two screenshots there are some of the flyer templates. So like I said, those will be downloadable Word documents. The documents themselves kind of provide the direction on how to fill in each of the sections. And then you'll be able to download those and use them on your own. So hopefully those will be good DIY tools.
Thank you so much, Emily, for sharing that background on this exciting new toolkit. I'm excited for it because it was certainly not for the faint of heart in terms of trying to wrap our arms around what works at Penn State currently and where the gaps are and how we can try to fill those gaps with some of these templates and guidance and resources that we know in the past maybe wasn't as robust as it needed to be in order to really help teams with their recruitment efforts. So really hoping to share that as soon as it is finalized. It's still being sort of uploaded to these web pages, and then we will share that broadly. But I just wanted to have a large group discussion, and we can raise hands, we can utilize the chat for what aspects of the toolkit do you envision will be particularly helpful for your research. And I can take us back to the previous slide that showed sort of the web structure of the topics that would be included. And then what else do you hope to see in the toolkit to assist you in your recruitment efforts? We know that part of this process to get the toolkit available to all of you was to at least have the bare bones covered, but we know that there's opportunities for growth and to really expand some of the content so that it's really as helpful as it needs to be to assist you as you approach recruitment in your various communities that you're seeking to include. And so I will go back to the previous slide. And you can see, again, listed the different topic areas. So just broadly speaking, are you all excited for this toolkit to come out? Do you think this is a resource that will help you? And any particular gaps that you might see that we can start thinking about including as well? That's a great question. So a question came in about a frequently asked questions on the web toolkit or have a separate page. That's something that is not actually developed. So that's excellent that you bring that up. We do actually have that for a community facing toolkit that we're working on through our cheer efforts to enhance community academic partnerships, but we don't have a frequently asked question page set up for this. So if that's something that we think would be useful, and it sounds like it would be for our researchers, then we can certainly look into building content. With that in mind, are you thinking of frequently asked questions related to the different tools and methodologies that work? Like, what's the best way from an implementation standpoint, or like what specifically around recruitment were you looking for? I think that was Rahul that posed that question.
Yes, I was thinking the FAQs about the study, like this is about recruitment. So what could be the most commonly asked question by the patient about the study or the process or outcomes or publication? So mostly, putting them upfront preemptively where you would anticipate those questions to be asked, or you have experience that these are the most commonly asked 5 or 10 questions for almost every single study. Over.
Yeah, that's excellent. Yep. We actually, we can adapt what we've created for our community partner toolkit, because we were doing that through the lens of participants coming to our community partners, asking about these specifics about the research study. Oftentimes the participant is, or the potential participant rather, is saying, like, I don't want to be the guinea pig, or, you're going to be doing some experiments on me that I don't fully understand. So really around those areas of trust and understanding that this goes through a very rigorous process to receive approval. We have a lot of compliance and guidance and regulations in place to ensure that we're protecting human subjects. But I think that's really important to look at it from that angle, through the potential participants' lens, the types of questions and how to best handle them. And not only about the types of study procedures, but what happens to my data, how is my data used? And a lot of that gets covered in the informed consent process, but that's, as we all know, is part of the overall recruitment into the project. So I love that idea. I think that's something that we can definitely create.
I think another useful thing would be aligning with the idea of trust of participants in the community, is having a section for resources for actually communicating. So linking to how would you, for example, request a group Outlook calendar and email so that your study can actually have a psu.edu address. Mm-hmm. I know many studies use Gmail. And so then it's just like a study name at Gmail, and it's not officially then like as obviously tied to Penn State. And so like just putting up front some of the resources that can be challenging to find on your own, so that we can all be communicating via like psu.edu or Penn State health.edu, and those types of email addresses might improve trust also in the process of recruitment and communication.
Yeah, that's excellent. Yep. And some of those pieces we do have in there for particular guidance, but I think it's important that we're really being mindful of making that very explicit in the toolkit of where folks can go for this actual implementation. And that's really this getting started at Penn State section is really trying to, guide you very easily to, okay, now I'm ready to get started. What do I do? Right. And so I love that idea to be very explicit in some of these resources. And I think we already have a section in there that talks about having a study email. I agree, that's much more, garners much more visibility to the project and it being at Penn State. So we want to leverage that as much as we can, but that's excellent feedback. Thank you. We are just over the hour, so I don't want to keep folks. I see more questions and comments coming in, so I'll make sure that we address that in our follow-up. So please keep adding to them. That Google document also will be available if you want to go back and add in some more notes. Our team will look at that and certainly be reaching out to those study teams for additional follow-up. I just wanted to go ahead and let you know that we will have a session in May coming up that is going to address requirements of federal funding agencies to expand diversity, equity, inclusion, and accessibility efforts in research. So we'll be able to speak a little bit more through that vein of how we can enhance diversity in the work that we're doing here at Penn State. And of course, our contact information is there. Please feel free to reach out anytime. We are happy to do consults and to really point you in the right direction with the different resources that we're developing. Thank you all for taking the time to join, and we'll be in touch with follow-up materials shortly. Take care.